Okay, we're live. So we're going to start the session on COVID-19 and implications for the dance community. So it's our pleasure to have two outstanding public health experts join us today for a presentation and then to answer questions. We have Dr. Lara Vaz and Dr. Beth Moracco. So Lara is a senior program director in the Population Reference Bureau. She received her Ph.D. from UNC Gilling's School of Public Health, Global Public Health, which is one of the best, if not the best, public health school in the world. She started dancing with her father, she says, before she could walk. I don't know if that's actually true or not, but I'm sure it's close.
There's photos.
And then she continues to dance, actually was active in the dance community in the Triangle before she moved. So it's a day job. She works as a public health researcher, studying interventions to shape policies and guidelines and how to translate them into real world actions. And her focus has been on health behaviors and infectious diseases, so clearly relevant to COVID, with an emphasis on how that occurs in low and middle income families. Beth also has a PhD and an MPH and is an associate professor from UNC Gilling School of Public Health. She's the associate director of the UNC Injury Prevention Research Center and an applied public health researcher. And her work focuses on developing and evaluating evidence-based preventions for programs and policies that deal with violence. And she is not a Latin dancer; she's a ballroom dancer. And so Bailacour is an organization that supports all kinds of dance. And so today they're going to make a presentation and then answer questions on COVID-19 and the dance community. They'll review what we know, what we don't know, and then answer questions that I'm sure many of you have in terms of how it relates to the dance community. So with that, let me turn things over to Lara and Beth. And I'll exit the screen and you can go ahead and get started. Thank you.
Great, thanks, Daryl. I also just want to let people know that Daryl, as a clinical pulmonologist, will be also available to answer questions. We are going to defer the clinical questions for him to answer. So waiting for our slides, we're going to talk about COVID-19 and the implications that the evolving pandemic in the U.S. has, in the U.S. and globally, has for our dance communities. Next slide, please. We're going to do some quick, frequently asked questions around prevention, give an update on where things stand with vaccines, and then provide a framework for decision making around COVID-19, followed by some reliable sources of information before we move into Q&A. Next slide, please. So I know everybody's question is when and how we can dance again, and how soon are things going to move back to normal. And I'm going to tell you right now, I don't know when things are going to be back to normal. But some of our frequently asked questions are around what testing tells us. We have two kinds of tests, or actually three kinds of tests. One is a rapid PCR test, which looks for the presence of genetic material. These are usually done with like a nasal swab or sputum or spit, saliva tests. These RT-PCRs, or the rapid tests, are rolling out across the states now, and they're more available in some states than in others. Usually you're able to get results back within about 24 hours. The other test, which is also looking for presence of virus, is an antigen test. It's also done by a nasal swab. They've been our traditional test as COVID-19 first hit, and depending on lab capacities and volumes and the availability of supplies, have taken several days to turn around. So hopefully now that we have the rapid tests available, and as long as supplies and staffing in labs is sustained, we should be able to get those tests turned around more quickly than in the past. The third test, and this is important, is that they're antibody tests, and usually these are blood draws. And these tests look for evidence of a successful viral battle won, or antibodies for now. I know that some people are being tested and having blood draws on a regular basis. This is only going to tell you whether you've successfully battled or fended off coronavirus, versus the antigen tests, which let you know whether or not the virus is currently present in your system. The two important things to know: one is that the status of you at the time of your test sample is what the test is going to tell you. If you go and get a test, and then between when you get a test and when you get your result have been in public and around other people, you could be potentially exposed. So it's, again, the test tells you the status at the time that you were given that test sample. Next, please. Two very important things. Not having symptoms does not mean that you're not infected. And not having symptoms does not mean that you cannot transmit the virus. And I think that's really important. We think that, and sometimes the word asymptomatic is used, which means no symptoms. Sometimes pre-symptomatic is used, meaning that you're infected, but you haven't showed symptoms yet. But it's really important to know that about as much as 40% of people who are infected may not show any symptoms, but can transmit to others. Next, please. So another question that has frequently popped up is how contact tracing works. First and foremost, the purpose of contact tracing is to slow the spread of COVID-19. And it does this by letting people know that they may have been exposed to COVID-19 and should monitor their health for signs and symptoms. It also helps people who may have been exposed to get tested and to quarantine until they get their results back. And by quarantine, we mean is staying apart from others. And it asks people to self-isolate, meaning if they are infected, if they have COVID-19, or self-quarantine if they are a close contact of someone who is infected. This is important because until you, again, goes back to the testing, until you've been tested and you get your test results back, if you've been exposed, potentially exposed, because somebody who reported that they were in a setting where they may have come into close contact with you, it's important to know to get tested, and also to, in the meantime, maintain social distance and actually stay away from others, again, to slow the spread of the pandemic. Next slide, please. So this is a big question that has popped up, and that is how we can keep a space that is safe. Clearly, the best way to keep space safe is to be outdoors or to do events and classes virtually. I just had a birthday party that was entirely virtual, and it was a very large birthday party, and it was a milestone birthday. But for everybody's safety, we ended up doing it virtually. If you cannot do something outdoors or virtual, look for large spaces that have good ventilation. And by that, we don't mean fans or air conditioning, but ventilation that pulls air out of a building and brings air from outside back in. So we're circulating air from the inside and from the outside in, rather than moving air that's in a closed space around, because then that's just mixing stuff up. It's like moving things in a blender. Be really important to have frequent disinfection with bleach of all surfaces that anybody may come into contact with. I think it's It's really important to consider requiring masks at all times. Doesn't matter if you're a group of 10 people or a group of 25 people. Masks are probably one of our greatest ways of reducing transmission at this time. Keep your numbers low. And the importance of keeping numbers low is tied to knowing that if you keep your numbers low, your chances of coming into contact with somebody who might be infected is also low. You want to keep touching or contact and mixing between people as low as possible. So the idea of exchanging partners may be something to reconsider in a setting. Again, every time we mix, we increase an opportunity for infection at this time. Little caveat is that before I was doing the work I'm doing now, I spent 18 years doing HIV work. And so a lot of what we are learning and a lot of the messages that are coming out around COVID-19 aren't that different than the messages that we had around HIV. Know your partners. Do you know who your partners have been with? How many people have they been with? Keep things safe. Have conversations. So some of these messages are very similar. Again, frequent hand washing and sanitizing. Hand sanitizing is important if you're going to be hosting an event, making sure that there are facilities as well as supplies available. Make sure that you have a safe, supporting, and non-stigmatizing way for people to inform you if they test positive. Again, this goes back to contact tracing. You want to make sure that you're able to know and that people feel that it's a safe space to let you know that, gee, I was at an event and three days later I tested positive. So it might be important to let others know. Names are not shared during contact tracing as a way to protect individual identities. So usually what happens in contact tracing is that you will be told that somebody that you've been in contact with within the last X number of days has reported that they've tested positive, and so you may want to get tested. Again, I think safe, supportive, non-stigmatizing is really important. This is not about blaming people for getting infected. We want everybody to stay safe. And as organizers, as teachers, as promoters, it would be really important to have contact information for every person who is in the space or at the event in case someone does test positive and informs you so that you have a way of contacting or letting others know. Next slide, please. So lots of pictures here. Again, I mentioned masks are great. In the absence of a highly effective vaccine, which we don't have yet, or some other miracle cure, we need to protect ourselves and protect others. And the best way we can do that is by keeping our respiratory droplets or our voice droplets from spreading from ourselves to others. And that also means from others to ourselves. We interact in communities. The dance world is a very large community, which overlaps with other communities. And so I think what we really want, particularly with the dance world and wanting to get back to dancing, is making sure that we are able to do so safely. The best masks that we have are the N95s and the surgical masks. There are still recommending, because of overall shortages in supplies and limited supplies, that these be used primarily in healthcare settings. Hybrid masks, or the cotton masks that are at least 2 layers of fabric, and some of them have inserts for filters, are a great other way of using things. The vented masks, which look, and I think there some of the N95s have vents in them. The vented masks don't allow you, they allow your respiratory droplets to escape you. So it's doing nothing to protect others. And for that reason, they're really not recommended. I know that they're largely available, and I see more and more people wearing vented masks, but they're not really helping to curb spread. It's just something to consider. Next slide, please. Really quickly on vaccines, people want to know where we are. There are vaccines in multiple phases of trial. There are 11 globally that are in sort of these phase 3 trials, which is the step before they become available for use. There are 5 vaccines that have been approved for earlier limited use. These have all been in China and Russia, where they've approved these vaccines without waiting for the results of the phase 3 trials. And that rush process is one that could have serious risks because it means that we don't know whether or not the vaccine really works, what side effects and what potentially serious side effects could occur from that, and whether or not the vaccine might actually be transmitting the infection not by mistake, but inadvertently. Next slide, please. For the US, we have 4 trials that are currently underway. I've shared these links. They're really important. They're all still in the enrollment phase. The Moderna trial has about 27,000 people still that are enrolled to date. Pfizer is at about 20,000, and AstraZeneca, I think, might actually bump up their numbers. A couple of really important things. None of the vaccines that are currently in phase 3 trials will be 100% effective. At most, they're going to be 50 to 60% effective. What does that mean? That means that it reduces your chance of getting infected by about half. Most of them, with the exception of the Johnson & Johnson vaccine, will require 2 doses to develop an immune response. And those 2 doses are usually about 30 days apart. And these trials are designed to look for differences between populations or the groups of participants who received the vaccine versus didn't receive the vaccine, to see if there are new cases, to see whether they're actually becoming infected as a result of the vaccine, as well as preventing new cases, and then also looking for side effects or complications from being vaccinated. Once a successful vaccine is found, the US plans right now are for a 4-phase rollout with, I believe, 3 phases in phase 1, and the general public being able to access the vaccines in phase 4. All of that to say that, is a vaccine going to be immediately available to the general public? Probably not until late next year, if the trials are successful. Next slide, please. Passing this on to Beth.
Great. I think this is where I jump in. Thank you, Lara. I'd like to point out, that's such a great segue, that in the absence of a vaccine and the absence of treatment, really the best protection that we have is through our behavior. And both of us actually studied health behavior, and we know from that people often will go through decision-making processes that involve weighing risk and benefit, but they do it kind of implicitly. They don't necessarily think about it. They use some cognitive heuristics that are almost instantaneous. And we're going to talk today about kind of a decision-making process that you can go through that really kind of explicitly helps you think through what are the risks and benefits of engaging in this behavior of whether it's a meetup or going to a dance class, etc. So, and you can actually apply these to all sorts of different behaviors as well. So the first is to really, think about what is that activity that involves in-person interaction, because as we know, that is the main way that the virus spreads. is through in-person interaction. And so, given that, what is the activity that you're considering? Is it a group class? Is it an individual class? Some sort of social dance event, a congress, a performance, either you performing or watching others perform, or both. Some sort of concert or brunch with friends or with others, or really any type of activity that would put you in contact with other people who are outside of your household or of your pod, the people that you've already kind of had contact with, and you've kind of got your little closed pod. Next slide, please. And then step 2 is thinking about, well, what is the risk, right, that the virus could spread during this activity? And that risk is based on several different factors. The first is, how long does that exposure occur? Will you be in contact with others for a few minutes, a few hours, a few days? Because again, the longer the exposure, the greater the risk of transmission. Secondly, and Lara already talked about this in some great detail, is what is the location, the place? Is it indoors? Is it outdoors? Is it virtual? Of course, with different kind of descending levels of risk in that list. Even outdoors, there's some risk of transmission. I was actually in downtown Apex today, for those of you who know the Triangle, and I was really surprised to see how many folks were downtown, walking around in the small downtown, sitting at outdoor cafes. Passing each other with definitely fewer than 6 feet. However, I was also really pleased to see that of the probably several hundred people that I saw walking around in downtown, I only saw maybe 2 people who were not wearing masks, even while they were outside. So that was encouraging. And then again, as we spoke about earlier, what is the space like? What's the size? Are you able to space out, physically distance 6 feet apart when you're sitting or resting or standing? What's the quality of the ventilation? Really important that you're drawing air out from the inside venue and bringing in air from the outside. I've walked by, I should say, not gone inside, to a few places where they had fans inside kind of blowing the air around, which of course, is kind of horrifying, thinking that really you're kind of blowing the droplets around into the space. And then how often is disinfecting happening? And again, I know that people are here from different states, and I know that it varies from state to state. In North Carolina, gyms just opened back up as part of phase 2.5. Gotten multiple emails from my gym telling me I should come back. And they're closing twice a day and wiping and sanitizing everything. At the School of Public Health, we are teaching all of our classes virtually. However, some of us are going into the office, or, of course, the labs are open, and we've got very detailed guidelines about sanitizing surfaces 4 times a day. Well, it's in an 8-hour day. So again, knowing how often is this sanitation cleaning happening, and then are there amenities available for hand washing? Sinks with soap, disposable towels, hand sanitizer, are those things readily available for the people who are going to be inside and interacting? And then, as I mentioned, the ability to maintain a safe social distance, which is still 6 feet apart. Now, I know from state to state, the number of people you can have at an indoor venue varies. Right now in North Carolina, it's 25. But, we also know that this varies from state to state, and that we do seem, in some places, to be moving down the road to, opening up more. And then thinking about who's going to be there, how many people, and what are their masking habits. Really, when you are getting together in an inside space, there's really needs to be kind of a social contract in terms of, what are the ground rules in terms of people wearing masks? Do we all adhere to those ground rules? When would you take the mask off? And knowing who is going to be sharing that indoor space with you. You know, we were talking about this yesterday as we were kind of doing the run through of the slides, is this really does remind us very much of the early days of the AIDS epidemic, particularly before there were antiretrovirals and before there, you know, where really HIV/AIDS was a fatal diagnosis, and how much emphasis there was put on communication, on making sure that you knew who your partner had been with and what kind of contacts your partner had had. And that you have shared values and beliefs about risk protective behaviors. And again, when you're going to be in an indoor space with other people, you're kind of entering into that social contract. Next slide, please. And then here's the part where you really need to make those conscious risk assessments and the risk, kind of those risk benefit analyses, where you're thinking about what would the negative consequences of COVID-19 transmission be for you and for the people around you. And, you know, in behavioral science, we talk about anticipated regret, and it's thinking through, you know, put yourself, you know, transport yourself into a time when you find out that you have tested positive, and what would be the consequences of that result for you and for the people who might have had contact with you. So thinking through, you know, oh, if this were to happen, you know, would I be able to find someone to take care of my kids? Who would feed the pets? You know, what are the consequences for my work? Do I have someone who could cover for me? Am I a caregiver for others? Or would I need to make sure that someone could take over those responsibilities for me? At the school, we actually had to designate who would take over our teaching if we were teaching this semester, if we were to fall ill. And, you know, basically for everyone who was teaching this semester, there was kind of a sub or an understudy who was able to teach the course and who could step in the event that we got ill. And how bad would that be? You know, again, how much would you regret and how bad would it be if this were to happen? And how bad would it be for the people around you? I have an 82-year-old mother who lives in the area, as do my adult children and my brother and his younger children. And kind of our touch point, or our kind of barometer for how risky or whether we'll engage in an interaction is always, you know, would this expose, or how likely is this that this would expose our mom? Because we know that even though she's very healthy, she's much more vulnerable than we are, and she, you know, is much more vulnerable to developing severe disease and for it to have a severe impact on her health. And then again, what would happen if you got infected, if you developed this severe disease, and if someone close to you, excuse me again, were to get infected? And then think about the importance of the event, because the reality is we don't know how long this pandemic will last. And, you know, as it stretches out longer and longer, we're going to be in situations where we have to make informed choices. We know that there are benefits to social interaction. We know that there are lots of benefits to dance. And those are not inconsequential. We also know that there are very serious consequences to social isolation. So, you know, we're not all doom and gloom here and saying that you should never do anything. It's just make informed choices and make choices that are informed by the science and by thinking through the positive and the negative consequences. So weigh the importance of participating in whatever that activity is against those potential risks and the negative consequences. So think through, what are the benefits of participating in the activity, the physical benefits and the mental, social, and emotional benefits. We've been having at the dance studio where I go, we've been having virtual happy hours every Friday. because we recognize that our dance community is an important part of our social and emotional health. And so even though we aren't able to dance with each other right now, we are getting together, different subgroups at different times. We'll be getting together every Friday from 5 to 6, 6 to 7. There are groups within the studio who are meeting outside for social distancing, and they call in for the happy hour wherever they're meeting from, where they happen to be. So again, thinking through what are the benefits. I always feel better after, as much as I am tired of being on Zoom, I always feel better after I've had some contact, either virtual, or I've started, for example, taking outdoor walks with friends, going on outdoor bike rides. And then what are the consequences of participating? And again, thinking through what are the risks and how high are those risks, and weighing that with the extent of the benefits. Next slide, please. So, and again, you can see some similarities here with HIV/AIDS. So thinking through, if you've decided, I've thought about the risks, I've thought about the benefits, and I'm ready to engage in this activity. So then you're in the position then to think about, well, what are the ways, now that I've made this decision, to reduce my risks or your risks, and also the risks. Yes, thank you. Also the risks to the others who are close to you, because that is a really important fact, that it's not just your personal risk or the risks of people who are kind of in your pod that you might have contact with later, but also the people with whom you are interacting at that moment. You've made the decision to interact in this environment, and you are putting all of those other folks, to some degree at risk, as you are accepting to be at risk. So again, how do you negotiate mask use? I remember, way back in the early days of the AIDS epidemic, and I was a Peace Corps volunteer in Central Africa, and a lot of what we were doing in our health education classes were talking about how do you negotiate condom use. How do you have those conversations, and how you don't wait to have those conversations to the moment, right? Same thing here, talking about mask use. What are the ground rules? And at what point do people wear masks? At what point can then they take them off? It's a lot easier to have those conversations when you have the time and the luxury to kind of talk through them than if you're at the point where people have to decide whether to put off or take off, or put on or take off a mask. How would you negotiate the number of people? Do you have a limit? Say, okay, once we get to this number of people, and it may be because that's what is allowed in this particular venue or by your state law. How do we negotiate that number, or what do we do when we've reached that number? Is it first come, first serve? Is there a sign up? Is it a lottery? But thinking through, okay, if we've decided only 25 people in this venue, how do we make sure that we don't go above that number? When one person leaves, can another person come in? I'm sure many of us have stood in the line at Trader Joe's waiting for someone to come out so that we could go in, because they're keeping their capacity, I think, at 25 or 30%. And then thinking through, particularly in a dance event, how would you negotiate the number of partners? Obviously, the more contact you have, the more, that you're increasing your risk. Again, at my dance studio, they've resumed individual lessons, socially distanced, with other couples, and masks and frequent hand sanitizing. And they're doing group classes, but they are not doing what we used to call practice parties, where everybody could come and we'd get the chance to dance with different instructors and dance with different students, just because of the idea of the multiple partners in a short period of time in one space. And thinking through, do you know where to get tested? And so, and a timely personal anecdote is that my son texted me in a panic yesterday because he had come down with 102 fever. body aches, sore throat, and was trying, to get tested. His primary care provider couldn't test him and didn't want to go to UNC. And the spoiler alert, he's fine. He actually tested negative for COVID and the flu and mono and strep. But he needed to have a plan B because he just assumed he could get in contact with his provider and then he could come in there and get tested. So it's always good to have plan A, B, C, and know where you can go to get tested. And as the day wore on and it was a Friday, he was getting more and more nervous about that. And then, do you know who and how to contact if you were to test positive, or if someone you had contact with within a 2-week period of when you engaged in your activity? And how would you get in contact with the organizer so that the word could get out that there had been someone at the event who tested positive? And I know they've talked about things like having a sign-up list with people's contact information so that you can, as we talked about earlier, so that there can be contact tracing. And contact tracing is really important, not just for the folks who would then need to go out and get tested or want to go out and get tested, but also for us to understand the spread of the virus and, kind of epidemiologically kind of understand how the virus is spreading, where it's spreading, and again, try to flatten that curve. And then thinking again through to worst case scenario, if you were to test positive, would you be able to safely quarantine? Where would that be? If there are others in your household, would they quarantine with you? If there are people who are about to be in your household, do you have a plan B? Can you quarantine and really avoid things like going to the grocery store, going to work? And how would those tasks be accomplished? So kind of thinking through what would the consequences be if you did need to quarantine or self-isolate. Next slide, please. So there is a lot of misinformation out there about the coronavirus, about the disease, about COVID-19, about how it's spread, about testing, and about the vaccine. So it's really important to get your information from a reliable source. And, we don't have necessarily a single place to vet all of these sources. The resources that are here on this slide are all very reputable. They're updated frequently, and they contain a lot of useful information, both in terms of how to keep yourself safe and also about the virus itself, and both kind of prevention and potential treatment. So we, as we said earlier, these slides will be available, and all of these hyperlinks work. And so there's lots of good information for you to get so that you can make decisions that are informed. Every day feels like a series of calculated risks these days. And so having the right information to make those calculations is really important. I think that was the last slide. I think we have a question slide, yes. So we have time for questions.
Great. So that's a wonderful summary. I may steal your slides for some presentations that I have to give. So we're going to make these slides available on the YouTube channel for people to download. Everything is hyperlinked, as I understand it, right? Mm-hmm. All right. So people can download these and go through them more carefully. And I can't emphasize enough the importance of reliable sources. There's a lot of news out there that you read on Facebook and other social media, and it's just not right. And you need to go to reliable sources. So while people are putting in questions, let me ask you to look into your crystal ball. So best case scenario and worst case scenario with the vaccine trials where they are now. When do you think a vaccine would be available? Assuming that it was a positive trial and it showed effectiveness and safety. And then how long will it take to vaccinate enough of the population that people can feel safe to kind of get back to normal again?
Those are two tough questions, Daryl. I think, as I mentioned, in the US, at least, the plans that have been released to the local health departments is for a 4-phase rollout of the vaccines. The first phase is actually broken into 3 parts, so it's actually 6 phases. The general public is not going to have access to the vaccine until phase 4. What does that mean? It means that the vaccine needs to go from being tested, approved, and then mass produced, and then distributed out to all of the local jurisdictions. That has like huge supply chain implications, right? Most of these vaccines, with the exception of the J&J vaccine, the Johnson & Johnson vaccine, all of them require temperature stability. So they need to be in what we refer to as cold chain. So they need to be kept within a certain like temperature range. How do you transport things from wherever the production site is to the locations? You're going to have like cold chain supplies available. So how quickly is that going to work? I think different states are in different counties and different local health departments. Some municipalities are going to be at different stages. I think best case scenario, and again, this is not a fully informed, because I don't work for a local health department, so I can't tell you what the specific local health department plans are. But I would say it's probably towards the second half of next year before we even see the vaccines being available to the general public. Now, your second question about how many people, will have been safely will have been vaccinated so that we feel like it's safe out there. That is not just dependent on vaccine availability. It also is hugely dependent on how willing people are to go and get vaccinated. And not just willing, but have access to the vaccine. Is the vaccine going to be freely available to the public? I honestly don't know. Well, I think the intention is yes. And Beth, I don't know if you have any more information, but I know that the first 100 million doses that have been provided are supposed to be free of charge. Yeah. But if you're talking about 2 doses, that's 50 million people. Yeah. Right? And we're a country of at least 330 million. We're in the middle, towards the end stages of a national census, and hopefully everybody's going to get counted. We may be a lot more than that. How do we make sure that everybody gets immunized? The vaccine itself is only, at best, with the vaccines that we have out, are going to be like 50 to 60% effective, which means that it's going to cut your probability of getting infected, or the chance that you're going to get infected, by half. It does not mean that you're not going to get infected. It means that it reduces your risk of getting infected. So again, it's going to take a lot. How many people are going to get their first dose and not get their second dose? I don't know. How many people would want to get a vaccine, but because of wait lines, because of the times when vaccines are made available at free spots don't coincide with their work schedules, or even copays, or if they don't have insurance, like all of those things are elements that still need to be sorted out. Beth, you look like you were going to say something.
I was mostly agreeing with you, just nodding along, but then I was also going to add, and you alluded to this, is that what the World Health Organization calls vaccine hesitancy is a huge problem as well. And some of the latest research that I have seen that said upwards from 40% of the population, the adult population in the U.S., has said that they would either not get the vaccine or are very hesitant to get the vaccine. So there's like accessibility in terms of physical accessibility to the vaccine, and then there's kind of the kind of mental accessibility or cognitive accessibility, and again, this is where there's a lot of misinformation out there as well. And social media is wonderful in a lot of ways, but it's also a very effective way to transmit false information or misinformation, and information around vaccines in general is a place where this has really exploded.
So we have a question from Beto, who's one of the local dance organizers, also actively involved in Malakura. He says, for dance professionals who make a living out of dancing and dance teaching and organizing dance events, what should we plan for in accordance to a time frame to, quote, go back to normal? And I'll add to that question, what will the new normal look like? You can, so maybe Beth, why don't you start with that, and then we can see if Lara wants to chime in.
Gosh, it's hard to say what the timeline will be. I think a lot of it's going to depend on the comfort level of both the instructors, the dance professionals, and their clients or teachers or clients or students. As I mentioned, at the dance studio where I have taken lessons and so on, they are open for business, albeit in a modified way. I actually just got a text from them yesterday, and they said that 75% of their students are back in the studio taking lessons and so on. And so, considering, I wish I could give you well, as of June 1st, but it's really difficult to do that. But I do know that there are places that have cautiously opened, and the new normal seems to be, masks at all times, frequent hand sanitizing, physically distanced, a limit on the number of people who can be in the space at a certain time, at the same time, and no group, not exchanging partners.
Lara, do you?
Sorry.
I'm sorry.
Yeah, no, Beto, I think, and hi, Beto, I miss you. A couple of things. One, I think, is the new normal is going to be better ventilation in studios. And until we know that the spaces, and those are where people go to social dance, as well as where people are going to take classes, until we know that those spaces are well ventilated, and ventilated not by having large fans, but by having fans that are pulling air out and bringing air back in. We're still learning a lot about the virus. I think we need to remember that this is a virus that came into human contact less than a year ago for the first time. And we have learned a whole lot about it in these last 10 months, but there's still a whole lot that we don't know. And we're learning more and more about the possibility of indoor transmission. And so while studios are opening up and people are teaching, the new normal may be that we're stop and go. The new normal may be that, and that's tied to Jessica's question, does 6 feet work for enclosed spaces? I would say if you're at 6 feet in a space with really bad ventilation, probably not. Because air needs to, those respiratory droplets need to be pulled out of that space. So again, we're still learning. There are new studies that are coming out all the time. What I do say, and it's one of the things that I speak of very cautiously, there's a lot of information that's getting press right now, and most of it is not yet peer reviewed. And what that means from when a study is done as a check to make sure that the study was done really well, that it was designed well, that it was analyzed well, that it's drawing the proper conclusions based on how the study was designed. It usually goes through a process where other scientists of the same, in that same field are reviewing the studies. What's happening right now in the desire to get information out quickly is there's a lot of information that's being spilled out before peer review, and then they're having to pull it back, because once people start looking at the quality of the study and the how it's being interpreted and how it's being presented, it's like, actually, no. So I think we need to be really cautious about that. I think our new normal is probably going to be masks. It's going to be hopefully the hand washing at all times, which will be great, not just for coronavirus, but for a lot of our infectious disease. Our water and sanitation folks are going to be really happy to see people washing their hands with soap and water properly, and not just like a quick rinse under some water. And we may be moving to more outdoors. We may be having smaller events. We may be doing, it's going to change what we're doing. Beto, I think some of your footwork classes, your body movement classes, those classes where right now you're not engaging with people, you're not having to be in like physical contact with somebody, are probably the safest of classes to be doing. I'm really encouraged to see how people are slowly moving or quickly moving into more virtual class environments. It's not the same.
It's not.
I have not danced in 6 months, going on 7 months, and I used to dance 4 to 5 nights a week. So it's definitely taking a toll on me as well. But I do think we can go further.
So Susie is asking a question about antibodies. So I guess these are the antibodies that develop against the virus when either when people develop the virus naturally or through vaccine. So I guess her question is, how long do these antibodies last? And will the antibodies lead to long-term protection or short-term, or do we not really know yet? So Beth, you want to take a first shot at this?
Yeah, I with the huge disclaimer that I'm not a clinician, and what I would say is that I think part is that we don't know yet. I mean, there were some kind of scary reports of people testing positive twice. Like after they had the, actually had the disease, and then and had the antibodies, and then testing positive for the disease again or twice. But that those seem to be rare, and it may have been an error with the test. And so So I would say we don't know if acquiring the virus and the disease confers lifelong immunity yet or not, because it's like, as Lara said, it's it's a new virus, and we're learning. Part of the reason you see information changing so rapidly is because we're just learning things every day, and so that's science, right? You change the facts as you learn them.
Right, and a lot of it is being determined now through some of these phase 3 trials. I mean, you don't really know how long the vaccine is going to last unless you vaccinate a population and then see how long they develop how long the antibodies last. So all that is stuff we need to know. So another Susie asks, so can you please give a summary of the current status of the treatments for COVID-19? So this is for people who have the disease versus the prevention. So either you want to take that, or
that's all you, Dr. Darrell.
So there's a bunch of treatments, and many of them are still in clinical trials. The things that we know that work are steroids, which dampen the immune system's response to the virus, which is good for people who have a very accelerated immune response. It works primarily for really, really sick people in the ICU in terms of helping them get through their illness better and with less mortality. Antivirals like remdesivir have been shown in randomized controlled trials to be effective. Not 100% effective, but reasonably effective. And then there's a bunch of trials that are ongoing now that are testing remdesivir plus anti-inflammatories, or dexamethasone plus and there's a big thing now for convalescent plasma, which is taking antibodies out of people who have had the disease and infusing them into people who just got the disease to try to prevent the disease from getting worse. And those trials are still out in the field, and we don't really know the results yet. I think at the last count there was some 300 or 400 clinical trials in various stages, and there are a bunch of things that are in the pipeline. Yeah. So I mean, the NIH is putting in the National Institutes of Health is putting a ridiculous amount of money into these using essentially all their clinical trials networks across the world to test some of these things. And the World Health Organization is doing the same thing. So keep tuned and keep up hope, because I think things are going to start popping up in the literature soon. So should I take a flu shot this year?
Yes.
That's easy. And what effect will it have on the efficacy of the COVID vaccines? Were these two independent things, or Beth, you want to go for that one?
Oh, I was just nodding that, yes, you should get a flu shot, and that it should, I mean, from everything I understand, it should not affect the efficacy of the COVID-19 vaccine if and when it's available.
Why is it important to get a flu shot this year more than ever in the past?
Well, Dr. Pulmonologist, tell us why.
I think it's because the influenza has a lot of the same symptoms that COVID has, shortness of breath and fever and, aches and pains and just feeling fatigue. And so we're going to get to the flu season soon, I guess starting up in October, November, December timeframe, and you're not going to know the difference. You feel sick. Is it COVID? Is it flu? Or maybe you have both. And that will wreak havoc on your immune system. So the goal is to try to get the flu vaccine, because we know that that's going to work significantly in a good part of the population.
Yeah. And I think also there's a community perspective on this, that our hospitals are pretty busy right now with COVID, and if they're going to have to deal with COVID plus flu season is usually a really busy hospital season. We're going to end up with hospitals that are at overcapacity again, and that is going to affect the ability for people who are sick to get care.
Right.
And as we move into the colder weather and, more people inside and more transmission of both, I mean, we got to a scary point in North Carolina where I think we were at 93 or 94% capacity, our hospital capacity across the state. And of course, that really varies in urban and rural areas. And so there were some places that were, at capacity. And so again, that idea of kind of flattening the curve and making sure that we don't exceed the capacity of our healthcare facilities.
Right. So we have a question: signs and symptoms of COVID. I guess I touched on that just a little bit ago. So it's fever, shortness of breath, loss of smell is a common side effect. Just feeling fatigue, and virtually anything can be a side effect of a sign of a symptom of COVID. I mean, they're GI symptoms. I mean, it's really amazing how this virus can affect the whole body. What percentage of people with the disease are completely asymptomatic? So, Lara, you mentioned that. You mentioned a lot of people were asymptomatic. What percentage, roughly?
We've heard as much as 40%. I think the other thing that's really important is quickly mentioning that while we have a lot of trials in the pipeline for treatment, a lot of it is around treatment for severe disease.
Yeah.
And what we're seeing more and more now are about 10% of the population who become infected are becoming termed long haulers. So there are people who have minor to moderate symptoms, but these linger for months and months and months and months. And people who are coming out of severe disease are also coming out with some pretty severe consequences of COVID-19 that are not necessarily around your respiratory system for months and months and months. So even if you don't get a really bad case, it may be something that sticks with you for a really long time.
Right. And the other point to make is that it's not just the people who have pre-existing conditions, the elderly and so forth, that are getting these kinds of conditions, these things that last. It could be, young, healthy, vibrant people who are super active and, never had aren't on any medicines, or, so it could be anybody. And that's the problem with this virus, is it can affect anybody, and you really can't predict yet who gets the bad part of the disease versus who doesn't have any symptoms or gets mild symptoms. That's been so we have a question from Lexi and Portia, spelled wrong. So does everybody know Lexi? That's my cats. It looks like Lexi must be on my other computer. That's kind of strange. The misspelling is because she doesn't spell very well. So she wants to know, can cats, and I'll add, can dogs and other animals get COVID-19, and can they pass that on to humans? That's an interesting question. Do either of you want to take that?
I'm going to let you take that. on behalf of your cats.
I will show. So this is Portia. So she actually.
Wow, fluffy cat.
So there have been reports actually of a couple of cats, very large cats, I think that that got the disease, but I don't know that there's been any example, a reportable example of where a pet gave the disease to their human.
Yeah, because there was a dog who tested positive in Chapel Hill, and I know there was a lot of banter about that, and what the question mark was how they acquired it, because it didn't seem to be that dog had been transmitted from the dog's household, from the humans in the household, or for other humans. So I think it's a pretty safe bet that your pets are pretty safe.
Yeah, and we in the laboratory we use non-human primate as a model, and mice get the disease, and so there's a variety. We know animals can get it, and whether or not they can transmit it or not is another issue. So I think we're about at the hour, and we have a few questions more in the thing, but we'll post those and maybe answer them after the fact. So I want to thank both of you guys, ladies, former dance community members locally and current dance community members, for joining us. And again, we're doing all of this for Balakura. Balakura focuses on cancer research, but people are also interested in COVID because of, and so we wanted to have a session this year on COVID, just because it's on everybody's minds. And so again, we thank you for your time and for putting together the slide presentation, and we'll end there and enjoy the rest of the event. Thank you.
Thank you. Thanks so much for inviting us.